Hello, Long Beach. It's Mayor Robert Garcia, and I want to wish everybody a good afternoon. Today's our briefing for December the 1st. As always, we will have an opportunity for questions. We also have a translation in Spanish at the end. And joining us today to be able to brief us really on a lot of the details of where we're at this moment is our health director, Kelly Colopy, who will make some remarks right after I'm done, and will also be available to answer any questions. Let me just start by just giving an overview of where we are. As of today, we've had over 16,786 residents test positive. The good news, of course, is about 14,500 of them have recovered, and people recover every day. But we've now lost up to 277 Long Beach residents to COVID-19. And that's a number that sadly continues to increase week by week. And those are, each one of those is a real person with a family who has suffered greatly and who wasn't there at Thanksgiving and won't be there for the holidays. And we just, in fact, just lost another 2 people just yesterday. So our prayers and our love go out to those families. I also want to just start by sharing with you how serious of a situation we're in today. You've probably been hearing a lot about the surges across the country. We know that there are spikes and surges happening all across our nation. In some cases, horrific incidents and states that are seeing enormous tolls in both death and in availability of hospital beds. Here in California, while we have throughout the last few months managed as best as we could, and have been really one of the states that have managed the best, we are starting to see things turn very poorly for us here in the state. And this includes Long Beach and the entire county. The governor recently has talked about where the cases are. And if you heard him yesterday, you know that we are on track, if our current trajectory stays the same, to be over 100% occupancy of our ICU beds in the state of California, and that includes us here in LA County and the greater region. And so we're in danger of not having enough ICU capacity for folks come Christmas if things don't change. And this isn't just about COVID-19. This is also about what if a father has a heart attack, or what if a kid is in an accident and needs access to medical care. We also know this is not just an issue about hospital bed capacity, because we can have endless amounts of beds. We can open up the convention center and put beds in there tomorrow. But if there aren't enough doctors and nurses to staff the beds, then care becomes worse. I want every single person in our community to have access to the absolute best care possible. And I want to share with you some data just from the last 30 days here in Long Beach. From November 1st to December 1st, this last month, this has been the status of our city. We have gone from, in our 5 Long Beach area hospitals, the ones that we track, we have gone from having an increase of averaging 29 patients with COVID-19 to 149. It's a 413% increase. 413% increase in 30 days that we cannot sustain for the next 30 days. If you look at just Long Beach residents that are in hospitals, and that's a number that's oftentimes on our dashboard, we went from earlier this month having 33 Long Beach residents in our hospital with COVID-19 to 86 as of today. That's a 160% increase of just Long Beach residents. And why are these 2 numbers important? Folks in our hospitals are from everywhere. We can't just track the Long Beach residents in our hospital, because we also have folks from Orange County and all across LA County and our neighboring cities. And so we have to look at total capacity and the amount of doctors and nurses we have available. And so when you see a number like 86 people are hospitalized, those are Long Beach residents. There are many more hospitalized that are not Long Beach residents that have COVID. And then there are dramatically more that are also hospitalized that are non-COVID patients. So the picture is important, and the big picture is really clearly something that a lot of folks need to understand. Cases. We've had a 313% increase in cases. We averaged about 40 cases a day 30 days ago. We're averaging about 190 new cases today. And in our ICU beds, we are at 64% occupancy in the ICU. Now, these numbers are alarming, and they should be. But the issue with COVID-19 that I think we all understand today is that it is a very, very large ship that is hard to turn around once it's going in a certain direction. And so regardless of what we implement today and additional restrictions that may come down from the state or from the county or from our city health officers, to move the numbers in the other direction are actually very difficult. And so I know a lot of us are tired and fatigued, and I'm tired and I'm fatigued, and no one likes to cause additional restrictions for anybody in business. The truth is, the priority must be saving lives. The priority must be ensuring that if your mom or dad need a hospital bed, there's going to be a hospital bed available. We know that in the last few days, LA County and other counties up in the Bay Area are doing similar actions, have made additional changes to their health order. We're going to be doing the same. I think it's important to note that when changes are made to the health order, it's not the city council that makes these decisions. It's not your mayor that makes these decisions. It's health professionals. It's the doctors in our health department. It's the medical professionals in our health department in consultation with their colleagues and other doctors across the state and across the region and county. It's our job and my job to support their work. And I have said from day one that I will support the decisions made by our health professionals, our doctors, and our scientists. And I will continue to do so. And so there have been some changes made that have been awful and hard and horrific, that have affected families and people's livelihood and their investments. And they have been personally hard to see in friends and people we have in the community. But I also know that the doctors and the nurses in our hospitals need our help, and they're counting on us to do the right thing. Today, there'll be additional changes made to the health order and Kelly Colopy will get some more details in a minute. The city of Long Beach, like other jurisdictions and certainly LA County, will be limiting any type of gatherings outside of households. This aligns with what's happening across the county because we know that gatherings, when folks are coming together, is when a lot of the transmission is happening. So that will be in place moving forward. We also know that we are limiting now playground use to 2 families at once. We know that other jurisdictions have closed playgrounds completely, and if we don't get good compliance, that might be where we're headed soon. But we also know how critical it is for families that don't have access, particularly to any outdoor space, to have some space for their kids. And so we're going to limit those pleas to 2 families at once. We have large playground systems, and if that changes our health department, that's the decision the health department made. And then you've heard of some occupancy changes that LA County has made in their health order. The city of Long Beach is essentially going to be continuing to work on our occupancy numbers as it relates to retail in the days ahead. Because we understand, as has been noted by Governor Newsom yesterday and in numerous media reports, that we can expect, if things stay the way they are and it looks like they're getting worse by the day, additional stay-at-home type orders or changes to the statewide guidance. And so we are in a daily consultation with the state, with our health partners, and I expect that in the next days, a week ahead, that we will have much broader statewide guidance as to where this is headed, because there is no situation that we can sustain where we run out of ICU beds by the time we're all celebrating Christmas and Christmas Eve. And so that is something to look forward to, that we'll wait and react to with our health professionals. Finally, I just want to say that one thing the science has taught us is that masking, when we are around others and in close proximity even, is important. We have an opportunity here to wear our masks when we're around and not being able to distance around others. And so we're going to hear from Kelly Colopy, our health director, and continue to get more information out as soon as possible. So thank you. Kelly.
Good afternoon, everybody. Thank you, Mayor. As the Mayor has shared, we've seen a lot of changes in our data, and the increases are going very quickly and at a slope that we did not even see this summer when we were in the middle of our surge. Our epidemiology staff have been really hard at work making sure that all the data are entered and that we have the best data possible to be able to make decisions. As you can see in this slide, you can see the incredible increase in the number of cases. So what this shows you is sort of the middle piece of it is our summer surge, and what you'll see toward the end on the far right is the number of cases that are being reported, in the last few days. And so we saw from November 1st, when we were having an average of 46.4 cases, so a 7-day average of daily case rate was 46.4. Now it's 191.6. This is a 313% increase, and we saw, over 200 and well over 200 cases reported out today. So we're just seeing really large increases. As with the data, it's evident that we're experiencing this dramatic increase, and we really do need to pay attention to how we slow down our cases, because what the cases that we see now is what shows up in our hospitals in the next 2 to 3 weeks. And that's also, as we're looking at our ICU beds and others, that could be what leads to an increase in deaths in the future. So we're continuing to track the number of cases, knowing that what the impacts will be upcoming. So in addition to each and every one of us taking the necessary precautions to prevent spreading infection, really what we need to do is just continue to really track and really focus on slowing the case rates. So if anyone who is experiencing symptoms of COVID-19 or you believe you have been exposed, we encourage you to get tested. A lot of people like to go out and get tested the next day out of concern, and I thank you for that concern, but it often takes up to 5 days before it shows up enough in your system for the test to pick it up. So we'd like to make sure that you are paying attention to that, and after an exposure or a potential exposure, please just stay home. Make sure that you are quarantining and taking those steps, and then after 5 days, then we encourage you to test at that point. Since March of this year, what we've really seen also is a lot of people being tested. We've tested over 343,000 people during that time, but our highest during July was just over 1,800, and that seemed like a lot at the time, except that right now we're testing 2,800 multiple days this week. And while we used to say maybe 300 or 400 on the weekends, we're now seeing 1,300 to 1,400 on the weekends, each day of the weekend as well. So there's just a huge increase in the number of people being tested. And we want to make sure that everybody has an opportunity. So for those people where it's difficult for them to leave their house, or people experiencing homelessness in encampments and in other situations, we are taking our mobile testing unit out, and we do pop-up testing throughout the city of Long Beach. We share these locations each morning on the health department's website, but you can also get the locations by calling the public health information line at 562-570-INFO or 562-570-4636. There is a large demand, and we have added staffing to our sites. We've added hours to the sites. We've added appointments, and we've added lanes. So we're doing everything we can so that anyone who is seeking testing can get into test. The ability to get a test same day, the appointments are full, but we continue to open at least 1,700 appointments per day. So every 3 days out. So within 3 days, you should be able to get an appointment no matter what. You can find more information on testing at our COVID-19 webpage, which is longbeach.gov/COVID-19. So I also wanted to talk briefly about the focus on the closure of restaurants and other businesses. I am very aware that there is frustration, anger from our restaurants and from many business folks, and I understand why, and I understand the frustration. We didn't make this move lightly, right? We haven't closed a sector at any point and taken it lightly. It's very, very difficult decision to make because we know what the impact is. We know what the impact is on folks. But we're looking at the increased cases and hospitalizations in our city. And then we looked at the highest risk activities for COVID. Being together, close together, is the highest risk activity that you can participate in. Restaurants and bars are the highest risk business still open in the city of Long Beach, where you don't have to wear a mask. So you sit together at a table, you're with people that are not your household. You sometimes are a foot apart, and you sit there for a couple hours. And when we look at high-risk exposures, we look at 15 minutes as a high-risk exposure. And when you're looking at restaurants, you're looking at just a much, much higher level. Sometimes it is households that go, but often it is the space that people gather. And we don't allow those gatherings anywhere else within the city except what has been allowed at restaurants. Many believe that they know that those who are out there, that they're healthy, they wouldn't be out, they don't have symptoms, they're all being good, so they aren't concerned. But what we're finding is the CDC provided scientific evidence that shows that more than 50% of exposures come from pre-symptomatic and asymptomatic people. So you may be going out with your friends, you may be going out with your family, and you don't know yet what's going on, and that you're sitting there still, no masks and very close together. The CDC also identifies restaurants, bars, and coffee shops as the key influences on community exposure increases. So when they look at all the different things, so holding everything else steady, it's restaurants, bars, and coffee shops that have the greatest impact on the community exposures. Many ask us to provide data that point to specific locations for outbreaks based on our contact tracing. I'll admit that this is difficult. Many people we contact either have been to multiple places and they have no idea where they picked it up, often because they're with people who are pre-symptomatic or asymptomatic within the time of exposure, so they're not clear on where it actually occurred. They may have been at a bunch of different places with a bunch of different people, and there's no way that you can identify it as a specific restaurant or a specific location. In many cases, people don't like to share information about the people they've been, that they're out with or where they've been because they don't want to get those places in trouble for the things. So, while contact tracing is very helpful and it does help slow exposures, it's not precise and it's not complete, given that people are just hesitant to participate. So I want people to be clear that we're using data on cases and hospitalization increases. We're looking at the wide-scale community exposure and community prevalence of this virus. And we're using science to make the decisions. We're pulling from CDC and many other sources to understand where the greatest risk will be. No decision to impact a business is easy. Every decision is hard. But we also have to really make sure that we're focusing on keeping people safe and our hospitals available to those in our community. I do say if you want businesses to open back up and you want to be eating at your local restaurant, it's incumbent upon every single person to take an action of your safest practice. The reason why everything is going up is because people aren't paying attention. They're done. They don't want to wear masks. They want to be with each other, but it's not going to get any better until people really start to change their practice. So next I want to talk a little about our vaccine planning. You're hearing a lot about vaccines. There are 2 out there that are coming through with success rates and things. So I wanted to share a little bit. We are hopeful that we'll have these available to us in the city of Long Beach soon. We are planning for at least a small amount to land within the city sometime either during this next month or in early January. It is our best tool in preventing future infections and stemming this epidemic. While a national plan for dispensing the vaccinations is currently being fleshed out, we've been planning locally for months. In fact, our public health emergency management team is coordinating with other city departments and local partners. We've trained and exercised for mass vaccination for years, including the vaccination of thousands of city residents in 2009 in response to H1N1. We also use our flu vaccine sites. So every time that people drive through one of our drive-throughs for flu vaccine, that's practice for all of us for when we need to start the mass vaccination for COVID. So all of those things are coming together and we're ready. So we just want you to know that we are, we're paying a lot of attention. We are preparing in every possible way, and we ask you for your support, your patience, and we look forward to partnering with you, all of you, in the effort to stem the tide of COVID in this community. Thank you.
Thank you, Kelly. We will now take questions from the media. There will be time for 1 question each. If media has additional questions, they can contact the Long Beach Joint Information Center. First question comes from Haley at the Press Telegram. Go ahead, Haley.
Hi, so I have kind of a 2-part question based on the fact that we know that it's still too soon to know whether Thanksgiving has contributed to a spike. So I guess the first part of my question is, do you have a sense of where the current surge is coming from? And then the second part is, do you know when we'll get a better idea of whether Thanksgiving led to a spike in cases?
So, as we look at the current surge, so during the end of October and into early November, we had a number of celebratory events. So we had, Halloween. We found far fewer kids out trick-or-treating and far more adults having gatherings and events together. So that is one of the areas. There are also, a number of different, the Lakers won, the Dodgers won. There are a lot of different people who are out and just more opportunities for which people want to celebrate. And, I think also the cooler weather has started to drive people more inside. So people aren't spending as much time outside, and that's always a concern. So that will also be Thanksgiving moving forward. But just generally, there's more out there, and the people are spending more time together in close quarters, and it's driving up the rates.
Okay, next question comes from Bernard at California Healthline. Go ahead, Bernard.
Yes, hello, thank you. I just want to ask about possible plans for alternate care sites in case as you were describing, in case the current trend leads to 100% plus occupancy of ICU beds and other beds in hospitals in Long Beach. And I know earlier this year there was talk of, and I think planning to convert the Queen Mary to an alternative care site. I was wondering whether that's back on the table or if you're discussing any other care sites at this point.
Yes, so we actually have one site that is identified that we would be able to set up and begin to operate as an alternate care site within 24 hours. So it's not the Queen Mary. It's a partnership with one of our local institutions of higher education. We also have the ability to set up at the convention center. And so we originally we were prepared to set up at the convention center this summer, and we still have the ability to do that if we need to move in that direction. So we have identified 2 different sites, and we have the capacity to move forward there if needed.
Okay, last question comes from Kelly at the Long Beach Post. Go ahead, Kelly.
Yes, hi, Kelly. You touched on this a little bit earlier, but I wanted to ask again. We have several protests scheduled over the next week or 2. We have one tomorrow where people are going to march in a protest of the health orders. They're upset, saying that Long Beach, with its own health department, could, take the route of like Pasadena and reopen restaurants. So what's your response to the people protesting, saying Long Beach can act on its own?
Well, it's true, Long Beach can act on its own. However, our cases are going up, and we're paying attention to the same, to the same data that LA County is paying attention to. And because of those increases, and because of the widespread virus and exposure within the city, we've chosen to move forward with the closure of restaurants, of dining, on-site dining of restaurants. I think the key piece for us is that we have many restaurants that do, a good job in terms of following the guidance, but even within that, because people are close together at tables, it still acts as a gathering with no masks. But we also have restaurants that don't follow the guidance as much, and we've spent a lot of time as a venue task force and others really trying to help to educate and things. But there were times, in the past month or so where there were areas of our city that looked like, some big parties were going on around restaurants and things, and so there's a real concern about how we keep people safe in those situations. And so it all comes together, and this is the choice that we made based on the data and based on what we're seeing in our community.
All right, that concludes questions, and we will now move on to Spanish interpretation.
Buenas tardes. Hoy es nuestro comunicado de prensa para hoy martes 1 de diciembre. Empecemos con datos generales. Hasta la fecha, 16,786 residentes han dado positivo por COVID-19 en la ciudad de Long Beach. Lamentablemente, hemos perdido un total de 277 residentes de Long Beach a causa de COVID-19, incluyendo a 2 personas ayer. El aumento que estamos experimentando se está moviendo rápidamente y ahora es el momento de tomar más medidas para frenar la propagación del virus. Los casos positivos de hoy pueden potencialmente convertirse en hospitalizaciones de la próxima semana y las hospitalizaciones pueden resultar en la muerte. Es por eso que ahora estamos viendo números de doble dígitos para nuestra tasa de casos. Nadie quiere que los restaurantes y pequeñas empresas sufran. Es por eso que ponemos a disposición recursos y fondos para ayudarlos durante esta pandemia. Dado el aumento de casos y hospitalizaciones, publicaremos una orden de salud actualizada que elimina las reuniones fuera del hogar y reduce la utilización de los patios de recreo a 2 hogares a la vez. Eso será en los parques cuando lleven a sus hijos, será 2 familias a la vez. El Estado está considerando también nuevas restricciones en torno a la capacidad que se anunciarán en los próximos días. Si seguimos en el paso que vamos ahorita, vamos a llegar a una capacidad del 100% en nuestras unidades de cuidados intensivo. Esto no es solo también por asistencia o camillas que ocupemos para personas con COVID-19. También tenemos que pensar en aquellas personas que necesitan los hospitales. Por ejemplo, si un padre o una madre tienen un infarto o si hay un accidente automovilístico, también se ocupan esas camillas para dar servicios. Tomemos en cuenta que cuando los números incrementan, la cantidad de doctores y enfermeras sigue igual. Entonces tenemos que tener bastante cuidado con eso. Tenemos un incremento de un 413% ahorita en los hospitales. Los casos también han incrementado un 313%. A principios de noviembre teníamos aproximadamente 40 casos al día y ahora esto ha subido a 190 casos diarios. La unidad de cuidados intensivos ahorita está a 64% y tomemos en cuenta que después del fin de semana festivo de Acción de Gracias, estamos esperando que esos números sigan subiendo. La prioridad ahorita es salvar vidas. Muchos condados han hecho cambios a sus órdenes de salud. No son los políticos que hacen las decisiones aquí en la ciudad, sino los profesionales médicos y científicos basados en datos. Hoy también hacemos cambios a nuestro orden de salud, alineándonos con el condado. Nuestra directora de Salud y Servicios Humanos, Kelly Colopy, nos acompañó y también ofreció datos adicionales. Los cambios en los indicadores de datos son alarmantes. Nuestro personal ha trabajado arduamente para ingresar datos para nuevos casos positivos que han llegado durante los últimos días. Como se esperaba, los números han empezado a subir todavía más. Esto empezó a principios de noviembre. La imagen que mostró con Kelly Colopy, que son los nuevos casos por día reportados, según la fecha, se informó a la fecha que recibimos información sobre la prueba positiva. Hemos tenido un gran incremento de casos que se han informado durante los últimos días. Esperamos que mañana se informen aproximadamente 200 casos positivos adicionales. Al igual que con los datos presentados anteriormente, es evidente que actualmente estamos experimentando un aumento dramático en las infecciones de COVID-19 y es fundamental tomar medidas ahora para disminuir la cantidad de casos nuevos, los cuales tendrán un impacto en hospitalizaciones y muertes. Además de que todos y cada uno de nosotros tomemos las precauciones necesarias para prevenir la propagación de infecciones. Una de las mejores acciones que podemos tomar para rastrear y reducir la tasa de infecciones es aumentar el acceso a las pruebas. Cualquiera de ustedes que experimente síntomas de COVID-19 o crea que ha sido expuesto, especialmente durante estos últimos días, por favor, hágase la prueba y evite infectar a otras personas. Como mencioné anteriormente, a principios de noviembre estábamos a 40 casos y ahora estamos a 190 casos positivos que estamos recibiendo por día. Eso es un incremento de 413%. Desde marzo de este año se han realizado más de 343,000 pruebas en toda la ciudad. Y continuamos ofreciendo oportunidades de prueba de varias maneras, incluyendo nuestras ubicaciones de pruebas emergentes y la ampliación de las horas de prueba durante estas últimas vacaciones. Compartimos nuestras ubicaciones de prueba emergentes cada mañana en las plataformas de redes sociales del Departamento de Salud. También puede obtener ubicaciones emergentes llamando a la línea de información de salud pública al 562-570-4636. Este mes, como el pasado, hemos visto un aumento significativo en la cantidad de personas que buscan pruebas en comparación con los meses anteriores. Ayer mismo se administró más de 2,800 pruebas entre todos nuestros sitios aquí en la ciudad de Long Beach, que es un poco menos que el número más alto de personas que se hicieron esa prueba anteriormente. Continuaremos haciendo que las pruebas sean accesibles y encontraremos nuevas formas de llevarlas a quienes lo necesiten. Para encontrar más información sobre las pruebas en la página de web de COVID-19 aquí de la ciudad, por favor visite longbeach.gov/COVID-19. Kelly Colopy también informó que, aunque muy difícil, tendremos que hacer un cambio a la orden de salud para restaurantes. Esto es definitivamente algo que es muy difícil para ellos hacer, pero basado en los números y los datos que estamos viendo, es algo necesario. Tomen en cuenta que el salir a un restaurante a comer, aunque sea afuera en el patio, es la única manera de que varias personas de diferentes hogares se pueden reunir sin máscaras por bastantes horas. Y sabemos que el 50% 80% de las personas que están contagiando a otras personas no tienen síntomas. Entonces, en esos lugares, en bares, en restaurantes, es un lugar donde estamos más vulnerables a poder agarrar ese virus estando con otras personas sin máscara por muchas horas. Estamos usando, y quieren recordar que estamos usando la ciencia para hacer estas decisiones y no va a mejorar la situación si no mejoramos nuestras acciones. Una de las cosas que se preguntó por los medios es por qué estamos viendo un incremento tan grande, tan drástico durante este mes. Y sí se mencionó definitivamente para Halloween, por ejemplo, no hubo tantos niños pidiendo dulces en las calles, pero definitivamente hubo un aumento en adultos teniendo reuniones para Halloween. También tuvimos el Día de Acción de Gracias el jueves pasado y los juegos de campeonatos de los Dodgers y Lakers también causó para un incremento de reuniones de muchas personas. Por supuesto, también vamos a hablar sobre la planificación de vacunas. Sabemos que muchas personas sienten curiosidad por las vacunas disponibles para protegerse contra el COVID-19. Tenemos la esperanza de que las vacunas estén disponibles en el futuro cercano como nuestra mejor herramienta para prevenir las infecciones futuras y detener esta pandemia. Actualmente se está desarrollando un plan nacional para dispensar vacunas. La planificación local ha estado en marcha durante varios meses. Nuestro equipo de manejo de emergencias de salud pública, en coordinación con otros departamentos de la ciudad y socios locales, se han capacitado y ejercitado para este tipo de esfuerzo durante años, incluida la vacunación masiva de miles de residentes de la ciudad en el 2009 en respuesta al H1N1, que recuerden también estuvo aquí. Y si recibió una vacuna contra la gripe en uno de nuestros sitios este año, esa también fue otra forma en que podemos poner en práctica nuestras estrategias de dispensación, así como hemos respondido a la creciente demanda de la necesidad de realizar pruebas. También responderemos en la vacunación a los residentes cuando llegue esa oportunidad. Anteriormente había mencionado que cuando se haga la prueba para COVID-19, también se le hará la prueba para influenza. Por si tiene síntomas, podemos identificar exactamente qué es lo que tiene. Muchas gracias por acompañarnos. Esto es todo por hoy. We thank you for joining us. That is all for today.